Hi, my name is Peter Schneider, and I'm here with the world-famous Dierk Scheinert. And Dierk and I have a lot to talk about, and we don't have that much time, so I'm just going to ask him a few questions so that everybody can kind of get a sense for what he's up to and what he's doing. So you probably know that Dierk leads the group of vascular specialists in Leipzig, and that they sponsor the LINC, the Leipzig interventional course every January. So I wanted to get a sense from you, so the January course is coming up soon. Give us a little bit of a preview on what you're thinking for this year, things that are kind of trending that you want to feature at the meeting. Anything special?
Well, yeah, of course, we are now in the phase where we kind of freeze the final program, and well, as in previous years, I think we have some big trends in endovascular intervention. We see a lot of new possibilities for treating critical limb ischemia, to try to revascularize patients to prevent amputation. We see a lot into the space of making procedures more durable, so the whole area of drug-eluting devices is getting more and more practical traction, in particular in Europe and other regions. So drug-eluting balloons, I think we are going to see more new data on that, and also how they really translate into clinical routine. But I also think about new areas like renal denervation is a big topic now, with more advanced devices coming around, but still a challenging area because we currently have relatively narrow indications for this treatment. And finally, a big focus at our meeting is all aspects of vascular surgical, endovascular procedures. Aortic repair is a big field. Well, actually, the biggest proportion of our attendees nowadays are vascular surgeons. And so that reflects also, I think, a trend that also there is a strong shift to endovascular techniques.
Yes, so vascular surgeons are the fastest growing group of attendees at VIVA also, actually. So tell me a little bit more about your group. So I've had the privilege of visiting a few times, and of course I've been to the LINC meeting. What gave you the ideas that went into building the group? I mean, it's an amazing group and everybody acknowledges that, but it didn't happen by magic, I'm sure. Give me a little bit of the backstory.
Well, I think we had the chance to move to Leipzig to form a department for interventional angiology. Meanwhile, it's about 12 years ago. And I had the privilege to already at this time work with some very good friends of mine, like Andre Schmidt, Sven Bräunlich, guys who already were working with me in the previous place back in the University Hospital of Erlangen. And when we moved to Leipzig, we got excellent opportunities in terms of infrastructure to build up our peripheral program. At this time, we also had the privilege to work with Giancarlo Biamino, who was a great teacher for all of us. And then I think we kind of inspired ourselves a little bit by working very closely together as a group, developing new techniques. We were taking a lot of advantage also of visiting other labs and seeing other people, other interventionalist techniques. And then we brought them home and always tried to bring them to the next level of perfection. That's also how we developed, or let's say, established techniques like transpedal access. It's not that we invented it, but I think we kind of worked a lot on making it a clinical, applicable routine technique, and
Yeah, so, and now people visit you and bring the techniques home from there. So, no, that kind of completes the circle. That's fantastic. So how long have you known Andre?
Well, as said, we worked already together in Erlangen. That we met actually in, I think, 1998. And then, we moved together to this new place and kind of developed our strategies together. And I think there is a very strong commitment from all of us to this program. It's kind of our baby in a way. Meanwhile, it's pretty grown up, but it's certainly a lot of identification with this project.
And of course, so I'm referring to Andre Schmidt, who is really a world-class interventionalist. He's done live cases for so many meetings and just does such a beautiful job of being able to focus on the patient care and on the teaching all at once, which is very, very unusual. So, and then you also mentioned Giancarlo Biamino, and of course he's one of the previous VIVA Atlas Award winners as a stalwart and a leader, as a scholar and academic person in our field of vascular. So that's also very exciting. So tell me now, what do you see is going to happen, or what do you predict is going to happen with device development? It's already so lopsided in terms of so many exciting things that happen in Europe and only come later to the US. How do you see this unfolding in Europe? Will it eventually be that device development moves away from Europe and toward other countries, or will it get stronger and better in Europe?
Well, I think that still we have an environment in Europe where we have regulatory pathways which enable us to get devices approved in a reasonable time. I think there have been some changes implemented within Europe, trying to harmonize pathways in the individual countries. And I think also they have implemented certain changes that let's say there is a more structured approach for getting protocols approved for CE marking, which I personally do appreciate, because that at least sets certain rules and makes also, I think, it's a responsible way of dealing with these subjects, still emphasizing that we also the authorities do not unnecessarily want to delay progress. But of course we can see that there are other regions in the world where regulatory pathways are nowadays easier, and we see that of course some of the first cases are nowadays done in other regions, which I think we can live with. We still have the opportunity, I think, to run a lot of the early larger trials on a high quality basis, and I think that's where we see the future.
And I think it is, the point you made about the rules needing to be done responsibly, I think that's a really good point. Yeah. Just in terms of protecting patients, but then also being able to enhance device development and to allow that to unfold in the best possible way. Yeah, very good. So let me ask you a little bit more now about how things work in your area. So I'm gathering, based on the amazing number of cases that you do, that you must have patients coming from a distance around Leipzig. What is that like? And so in the US, we're not as familiar with how the system works in Germany. And of course, the US system is in the process of changing a lot right now. But tell us, is the care regionalized, or how does that work?
Yeah, I think we have seen changes over the last years. When we started back 10, 12 years back, I think our center was clearly leading in the terms of providing endovascular interventions, and we of course trained a lot of doctors regionally, but also from other areas of Germany or other countries. And I think meanwhile, of course, we've built up our own competition, so that we see a lot of smaller facilities have opened up endovascular services in the past years, which I think is a good thing, because vascular patients by definition need a regional local care. They are not always able to move to over larger distances to the next referring hospital. Having said that, we were successful in establishing our center as a referral center for challenging cases, which cannot be done in all the regional places. And that's why also currently our patient load comes really from a distance, I would almost say all over Germany, but certainly a radius of 150 kilometers around Leipzig. This is how we hope to ensure also that we are staying relevant in the future and we can maintain our workload.
Right, that makes sense. So for the near future, at least, maybe for the foreseeable future, the Link organization and the VIVA organization have a lot of similarities. One is that it really is multidisciplinary. When you go to the meeting, you get the views of every specialty involved that wants to and is interested in treating vascular disease. Another thing that is a similarity between VIVA and LINC is just sort of the collaborative nature of both organizations. So over these past several years, we've been collaborating, having a VIVA session at the LINC meeting and a LINC session at the VIVA meeting, and of course your group has been very prominently participatory in this year's VIVA meeting. But then this year we decided to collaborate on a new award, and can you tell a little bit about that, the Vascular Career Advancement Award?
Yeah, I think that's really I think a very good new idea, which I was very happy to see that it was coming up from both sides of our organizations, that we would award somebody who is not at the end of his career, as we typically see with lifetime achievement awards, but rather focus on the young rising stars and people who really have shown a strong commitment and also have a credible curriculum already. But we wanted to help them to get recognition and also stimulate them for moving on in their career, and of course also setting a trigger to others who see that to potentially follow the same direction. So it was a great privilege for us this year to decide together on the first two recipients of this award, and I'm pretty sure we took a good choice here.
Yes, I agree, yes. So no, I see that as something that could really blossom in future years as a great tradition. So just one last question. Give us a rundown on what a angiologist from Leipzig does for summer vacation.
Yeah, well, there are different ways. Like Andrei likes to spend the time with his family always in Croatia, where a part of his family comes from. There seem to be some very nice, very remote islands where you can really find some peaceful moments. And I did the same. My wife and I, we very much like being in the United States. We spent time in Florida, and we actually took a week off in the Bahamas to really get away from everything. It was really a very good family time for us.
Sounds fantastic. Well, thanks a lot, Dierk, for
Thank you.
visiting. Appreciate that.